Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Imagine walking into a clinic exhausted and worried. You describe a symptom that sounds real to you, a stabbing pain, a blotchy rash, a heart flutter. But by the time the clinician examines you, the symptom has quietly disappeared. You leave with a shrug, a script for ibuprofen, or a note that exam normal. You go home wondering if it was all in your head. I hear that story every week. Today, I'll give you a practical fix, a low-effort 1-week symptom tracking plan, and exact scripts to use so you stop being dismissed and start getting answers.
Section 1. What to expect and why intermittent symptoms confuse clinicians. Here's the roadmap. First, we'll cover how clinicians think about timing and patterns. Then, I'll give a simple tracking template you can use. And finally, we'll practice exact language for appointments, along with clear red flags that demand urgent care. The concrete outcome: by the end of the episode, you'll have a usable 1-week tracker and 3 short scripts you can copy into your patient portal or bring to a visit. Now, why are intermittent symptoms so tricky? Clinicians rely on 3 kinds of information: what you remember, what they can observe in the office, and objective data like vital signs or tests. When a problem is episodic, those 3 things often don't line up. You remember a frightening episode from last week, but in clinic you're normal. The exam and routine tests look fine. That mismatch creates uncertainty, and humans, clinicians included, are wired to favor what they can verify in the moment. That's not your fault. It's a limitation of the clinical encounter.
A few specific reasons this happens. Timing and recall bias. We naturally remember the worst moments and forget details like duration or what helped. Symptoms vary in intensity, so a clinician who sees you between episodes might undervalue the problem. Many diagnostic tests only capture abnormalities during an event. A normal EKG in clinic doesn't rule out intermittent arrhythmia. Lastly, vague descriptions like "it comes and goes" without specifics are difficult for clinicians to act on. Understanding those limits is the first step to using the clinical system strategically rather than letting it steamroll your experience.
Section 2. What to track and how. This is the practical heart of the episode. You don't need a medical degree. You need consistent, objective notes. Use this minimal template every time a symptom appears. 1. Date and start time. 2. Onset, sudden or gradual. 3. Duration. How long did it last? If it stopped and started, give an approximate range. 4. Intensity. Rate pain or discomfort 0 to 10. 5. Trigger or activity. What were you doing just before it started? 6. Relieving factors. What helped, if anything? 7. Associated symptoms. Nausea, sweating, lightheadedness, shortness of breath, rash, fever, weakness, numbness. 8. What you did. Did you take medicine, lie down, use an ice pack? 9. Objective data if available. Heart rate, temperature, blood pressure, photo or short video of the rash. 10. How it affected function. Could you drive, work, or sleep? Keep each entry short and factual. Think of it as data for your clinician. A 1-week tracker plan. Use a single note app, a paper notebook, or the notes section in your patient portal. Each time a symptom occurs, make 1 short entry using the template I just gave. Aim for 20 to 40 words per episode. If the symptom is a visible rash, take a timed photo and label it with date time. If it's a palpitation or dizziness, note your pulse if possible, and whether caffeine, exercise, or stress preceded it. Don't feel like you must capture everything. Consistency matters more than perfection. At the end of 7 days, you'll have a pattern to share. That is immensely more useful than one anxious narrative during a single clinic visit.
Section 3. How to present the information, when to escalate, and exact phrases to use. First, presenting the information. Start with a 1-sentence headline, then offer the data. Example headline: I'm here for intermittent left-sided chest pain that started 2 weeks ago. Then provide the pattern using your tracker. In the past 7 days, I had 5 episodes, each lasting about 2 to 3 minutes, intensity 6 to 8-10, usually when I stand up, and I felt lightheaded during the episodes. I logged dates and times in my portal and attached a short video of 1 episode. That format, headline, pattern, attachment, helps clinicians quickly grasp the problem and the quality of your data.
Exact scripts you can copy. At check-in or in the portal, I want to make sure my intermittent symptoms are taken seriously. I've tracked 5 episodes this week with dates, times, and attached photos or videos. Can you review these before my visit and let me know if there's a monitoring test we should start? In the visit, if you feel dismissed. I understand my exam looks normal right now, but these episodes are affecting my life. Because they're intermittent, could we arrange an ambulatory monitor, a photo log, or a short-term follow-up in 2 weeks to review data? When asking for a referral, if initial testing doesn't show a cause, I'd like a cardiology, neurology, dermatology referral. Can we set that up or agree on a timeline for next steps? Use neutral, collaborative language and bring your tracker. It's evidence, not whining.
Red flags. When to escalate immediately. Some intermittent symptoms are urgent. New or crushing chest pain with sweating or fainting. Severe shortness of breath that doesn't improve with rest. Sudden weakness or numbness on one side of the body or trouble speaking. High fever with altered mental status. Uncontrolled bleeding. If you experience these, call emergency services right away. For less dramatic but worrying intermittent symptoms, recurrent syncope, repeated brief strokes or mini-strokes, palpitations with near fainting, or progressive neurologic change, push for expedited testing or referral. Script to use. These episodes include near syncopal events, and I'm worried about safety. Can we expedite testing or arrange urgent referral? Be explicit about safety concerns. Clinicians respond to concrete risk language.
A few practical tips that help your case: attach photos and short videos to the portal rather than describing a visual event. Highlight objective numbers like heart rate or temperature. Keep your tracker entries consistent so a pattern emerges. And ask for a time-bound plan if the first round of testing is unrevealing. For example, if monitoring is normal, let's plan a specialty referral within 4 weeks. That prevents concerns from being dropped. If you feel dismissed, ask for a second opinion or patient advocate. You're allowed to be persistent about your health.
Top takeaways. 3 actions to start today. 1. Start a 1-week tracker using the template I gave. Date, time, onset, duration, intensity, triggers, relieving factors, and attachments if possible. 2. Prepare 2 short scripts to send in your patient portal or read at your visit. A concise headline and a 1-paragraph pattern summary, and attach any photos or videos. 3. Know the red flags and have a simple escalation plan. Call emergency services for severe, new, or progressive symptoms, and ask for expedited monitoring or referral for recurrent near-syncopal or concerning neurological or cardiac events. These steps reduce vague storytelling and give your clinician usable evidence to act on. If you found this episode helpful, I made a downloadable 1-week symptom tracker and sample portal scripts available on my site. Visit faqbynursejessicaconsulting.com/tracker to download the PDF and copy the scripts directly into your notes. If this podcast is useful, please subscribe so future episodes reach the people who need practical, nurse-led guidance.
Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynursejessicaconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.